Greetings, class. Dr. Winkler back at you again. I have a special guest presenter here this week, Dr. Max T. Ragland, one who actually I know very well. He actually served as one of my dissertation committee members. He's doing some phenomenal work as pertains to a special population, which he will touch more on as he goes throughout his presentation. And I guess I'll do this. This will be a special presentation because this week we had something else scheduled, but we've already covered that. And what I wanted to do was bring a little, I guess, something more specific and something more beneficial, I would say, as pertains to working with certain populations. I've even heard some of you mention working with this particular population that Dr. Ragland has done extensive research on and have great experience and does a great work and phenomenal work as he intervenes. So, and I want to tie it back to the course. The course description says this course addresses the origin of violence and how it contributes to the development of an abusive personality. We're not going to get stuck on, let's say, pathologizing anyone, but there's definitely some reality about personalities being created and developed. And I'm pretty sure Dr. Ragland will talk about that. And as you all know, there's some disparities and systemic issues that cause and aid in the development of these personalities. The course will examine how repeated exposure to traumatic events affects the development of interpersonal relationships and neurological functioning and development. Specific counseling techniques for the treatment and trauma will be presented. So with no further ado, I want to thank Dr. Max T. Ragland, affectionately known to me as Baba Ali,
Thank you
for joining us today, and I'm going to turn it over to you, Doctor.
Yes, sir. Thank you, Dr. Winkler. I really appreciate you extending this invitation, inviting me out to be a part of your class. As Dr. Winkler has stated, that a little bit about my background is that I'm a licensed clinical professional counselor here in the state of Maryland, and Dr. Winkler and I have been, I guess, in a professional capacity and a non-professional capacity, personal capacity, if you will, known to for quite some time. It's been my pleasure having the opportunity to work with Dr. Winkler in providing a service for Baltimore City, work with some of the clients in Baltimore City. So when he asked me to be a part, to do a presentation in his class, I was very excited about that. This is something very dear to my heart. So I'm not going to talk a lot about myself, but I would like to say that Dr. Winkler shared with me that many of you, not all of you, who are enrolled in this counseling program, at some point in time will be moving on, getting your license in the as a professional counselor. Some of you also, I guess, will become licensed in addiction counseling. So with that, I would say congratulations, continue to study hard, continue to apply yourself in this chosen profession, and you all will be needed because there's a lot of, unfortunately, there are a lot of men and women who are in need of mental health services. There are a lot of men and women who are in need of addiction counseling services, if you will, and because of the drug, substance abuse, alcohol abuse that they're dealing with at this time. So your services, your talents will be needed during this particular time. So as I get into the presentation, I'm going to talk a bit more why it's so important at this particular time and date, why you should be, what you're doing is really going to make a difference. So I'm sure, as you can see behind me, so my topic that I'll be talking a little bit about this afternoon is entitled Transition Therapy: Theory, Research, and Recommendations for Treating African American Males Experiencing Post Incarceration Transition Syndrome. As Dr. Winkler shared with you, the African men and women, if you will, say who have a history, as I define, being in prison, who have a history of criminality, is considered a vulnerable population. I chose this specific population and for a variety of reasons. But the primary reason why I chose this specific population was, like so many of the men and women that I see, that I work with, that I provide services for, at one time, I was that man. I was that man sitting in a jail cell. I was that man who was obviously incarcerated. I was that man who lived a criminal lifestyle. But along the way, I made a decision to change my life, and to not only to change my life, but also wanted to make sure that I would be in a position that I can help others to change their lives. So being a licensed clinical professional counselor is extremely important to me. But I would say equally is the work that I provide gives me my greatest satisfaction. So with my slide, theory, research, and recommendations for treating African American males experiencing Post Incarceration Transition Syndrome. This came out of I had completed my dissertation, and as a result of that, wanted to do an independent study. And the independent study that I did was examining how African American males, say, who have a history of criminality, transition back into mainstream society. So I would say a great deal of the research that I've done with this particular population has come from not only my dissertation, but also came from my independent study, as well as my own personal experience. So as I begin to talk a little bit about my presentation, there are some key definitions. And the definitions that you see up on the screen right here is very critical to the development of this particular population. And I'm not going to go through them all, but as you can see, there's white supremacy, there's institutional white supremacy, there's American racism, criminality, cultural criminality. And I want us to think about those words as I go through this presentation, because this is very critical, say, to the development of the men and women who are treated. But I would say it's very critical, say, to the mindset of America as a whole. So what is that we must know? So I would say the challenge that is facing mental health practitioners in the second decade of the 21st century is, how do clinicians work as a collective body to analyze, design, develop, implement, and evaluate a healthy therapeutic environment for men and women who have been marginalized by a social system of institutional racial practice? So it seems like a lot. In a nutshell, as I stated, we have a responsibility as clinicians, whether you're a social worker, whether you're a licensed clinical professional counselor, whether you are a psychologist, whether you're a psychiatrist, whether you're in marriage and family therapy, whether you're an addiction counselor. We have a clinical responsibility. I believe we have an ethical responsibility to say that when we are providing services for the men and women whom we treat, what is it that we're offering them? What is it that we're trying to do? In what way can we help them? And one of the things that motivated me as I began on my own journey and wanted to help, I realized early on that the current practices or the current treatment modalities or the current theories have been around for at least 50, 60, maybe 70 years. And I would argue that as great as many of those theories are, whether it's Sigmund Freud, whether it's Carl Jung, Adler, whoever you subscribe to, all of those theories come out of a Eurocentric mindset, if you will. Now, this doesn't take away from what they represent, because myself, I like to have an eclectic approach. I do pull from psychoanalysis with Sigmund Freud. I think it's very useful when you look at, say, beyond the subconscious. I think that what he offers has advanced, I would say, thought around psychiatry, psychology, and how he has helped, say, to model, if you will, for those who came after him, some of the great advancement in terms of looking inside, say, the subconscious, and being able to to pull from that in a way, working and treating his clients. But also have to keep in mind that when Sigmund Freud developed his theory pretty much was framed around white women who were experiencing sexual repression. That wasn't the only aspect of it, but majority of his clients were white female. And so how do we apply that theory, say, in 2023, say, to an African-American male? How do we apply that to a 2023 an African-American female, say, who's experiencing, say, some mental health issues? Now, can we pull some of the treatment approaches? Can we pull some of the techniques from that? Sure, we can. But again, what I believe and I maintain is in 2023, much of the mental illnesses that we're seeing today we have to begin to think about how do we begin to develop theories around what we're seeing today. And I'm going to talk a bit further about the reason why that is so important. So to overview, what is PITS and how it is manifested? When I talk about PITS, PITS is just an acronym for Post Incarceration Transition Syndrome. Contributing factors to the African American male psychosis, transition therapy, a treatment approach for African American males transitioning out of prison, and strategies for moving forward. So this is kind of an overview of some of the areas that I want to touch on. What are some of the potential takeaways? You know, the relevancy of the African American males who have a history of criminality and incarceration, institutional racism, and its psychological consequences, if you will, say on the particular population, identifying specific negative behaviors used to cope with the trauma. Keep in mind, we talk about trauma, a psychological maladjustment of transitioning from prison back into mainstream society, but also strategies to restore healthy thinking and behavior. So hopefully there will be some of the takeaways that you would take away, say, from this presentation. So what is PITS? So again, as I go through each slide, I'm not going to read verbatim. Obviously, it's something you can do yourself, but I do kind of want to summarize the slide that you're seeing. So in a nutshell, what is PITS? PITS is a psychological maladjustment, as I have defined. It's a psychological maladjustment that African American males experience when confronted with the social stigma of being a felon on probation, parole, or a registered felon in the criminal justice system, and the lack of social opportunities that is available to them or her when released from prison. So we talk about a psychological maladjustment. So what I'm simply saying right here is that, unfortunately, for so many African American males who are returning home from prison, they are failing to adjust to mainstream society laws, norms, customs, and practices. And why is that so? Because what you have the clashing of two worlds. You have one world of someone who has embraced a criminal mindset in a world that says that this is how you're supposed to live. So there's a clash of both worlds. But what has happened is that, unfortunately, a lot of the men and women who are returning back into mainstream society, they have not made those changes necessary in order to be able to adapt, if you will, once they come back home to mainstream society. But we can't begin there. No, that is the obvious observation, if you will. But we have to go back and say, well, what has happened? What has happened to these men? What has happened to these women that where somewhere along the way they made a decision to commit their crimes? Now, we all know no one has control over us. We all have a conscience. We all have free will. We make our decisions. But can a society be influential in a way that can create, if you will, personalities, realities, that where within that environment, it will begin to shape your mindset in a way that where you can make irrational decisions, criminal decisions, decisions that would be harmful, say, to you, to your well-being, and to your family. We're going to talk a bit about that. Also, when we talk about PITS, PITS occurs in African American males as a psychological failure to adopt a new process of thinking and living that is a result of long exposure and living in a controlled environment. So again, what am I talking about? I'm talking about a psychological failure. Because keep in mind now that when these men and women return back to mainstream society after living, if you will, say in a controlled environment and living in a prison for a long period of time, there's an adjustment. But sometimes within those environments, what ends up happening is that they begin to adopt, these men and women begin to embrace a criminal culture that's institutionalized to their negative thinking, their negative behavior, their negative way of life. So there's an aspect of PITS that these men and women, they struggle with when they come back to mainstream society, because they have been in prison for a very long time, and not only have they failed to adjust to the stigma, but also they have been institutionalized in their thinking in a way that has been harmful. And the last aspect of PIS is that PIS is further exacerbated within the African American male experience when released from prison by conscious or subconscious behavior of an integration of cultural misorientation beliefs in his daily life and the unhealthy response to the prevalent systemic practices of institutional racism. Now, I'm reading this because I want to be very clear. So there's a cultural aspect as well, not only a psychological aspect that these men and women are dealing with or having to face, but there's a cultural, what we call misorientation. And when I talk about cultural misorientation, simply what I'm saying is that unfortunately, many of us, even myself at one time, had embraced a way of life, a way of thinking that was foreign to who I was as an African American man, as a black man. So there was a cultural misorientation, adopting a lifestyle, a mindset that was detrimental to my behavior. But this particular mindset has been fashioned within society that I embraced in a way, in thinking at the time, that this was a way of life that I truly believed that I wanted to live. Only to find out later on what I was doing to myself. I was hurting myself, hurting my family, and hurting my children. So when I talk about cultural misorientation, simply put is that acting out in a way, embracing a lifestyle, a way of thinking that's detrimental to my well-being. So what are some of the social profiles? Again, I will argue, when you think about PIS, I developed what I call a psychosocial profile. Now some of the bullet points that you see on the screen here, it doesn't encompass every aspect of it, but what I'm putting forth is that whether you live in Baltimore City, whether you live in Chicago, whether you live in, say, in Detroit, Los Angeles, New York, whatever major city you live in, urban area where you live in, there's a particular profile that comes out that the young men, particularly the young African American males, that this is a part of their profile. 18 and older, multiple arrests, history of criminality, history of incarceration, high school dropout, drug use, alcohol, coke, crack, heroin, raised by a single mother, living in a crime-infested neighborhood, no marketable skills, no substance abuse and mental health treatment, experienced environmental and personal trauma. Now, this is an area many times that we don't want to talk about. This is not an indictment against anyone, any mother, any parent, any particular city. But we have to be realistic about if we're offering services, say, to these men and women, and we generally want to help them and help their families, is that we have to begin to look at this profile. So you take this profile, and you take this profile that you're seeing behind me on the screen right here, you take New York City, and say, in Rikers Island and some of the other correctional institutions, and you talk to those men and you ask them about their backgrounds. I would argue that many of those men that would fit this particular profile, even though this particular profile was done right in Baltimore City. But I'm putting forth, you can take this profile to Washington, D.C. You can take it down south, say to Arkansas, Tennessee, Alabama, Georgia, South Carolina, New Orleans, Texas. And it would be the same profile. Because what we're talking about a systematic, if you will, a systematic way of life that's been institutionalized in the country that we live in, unfortunately, that is creating this profile that where unfortunately too many families become victims of this particular reality, and as a result of that, having to find themselves, how do I come up out of this? But as a result, it creates the behavior that I prefer to talk about. So we're going to talk a bit about trauma. Personal and environmental trauma. So when we talk about trauma, which is part of this class right here, we talk about direct personal experience. We talk about an event that someone has experienced themselves. We talk about witnessing an event. So it's direct personal experience, it is witnessing an event, or it's learning about an event. But what is happening here? So to give an example, someone who experienced trauma, we use the home for an example. Someone who's in the home, say a young boy or a young girl, say was molested. This is what we call a direct personal experience. But now let's just say that within that home, the young girl or the young boy has a sister or a brother. And the young brother or the sister or the brother had witnessed the father or the mother, say, sexually abusing or physically abusing their sibling. So now they become traumatized by it. But say now you have a cousin who did not live in the home, who wasn't present in the home, but was told by a family member that her little cousin, little boy, or little girl had been molested by the father. Now she becomes traumatized because she learned about this. So trauma in itself, as defined according to the American Psychological Association, is that it can be a direct experience, it can be a witnessing event, or it can be learning about this. So you ask yourself, how is this so? I wasn't present in the home. So what is trauma? Trauma simply is just an act that you may experience, that you may hear about, that you may witness, that is so overwhelming, that is such a threat, say, to your well-being. It is such a disruption of your psychic energy in a way that where now you begin to where it impacts your life, to where you're not functioning, say, in a healthy state of mind, if you will, because the stress of that event is weighing on you in such a way that is causing you to act out in a way that is unhealthy. So what do I mean by that? So again, let's say, use the same example, the child who was actually molested. Okay, now the child may begin to act out in school. Maybe the child may begin to have some fear of being around the person who actually say, touched him or her. Or maybe the child begin to act out himself or herself against another family member. This is because there's a direct personal experience that the child has experienced with someone molesting them. But what has happened is that child has been seriously injured in a psychological way. That child innocence has been affected in a serious way. That child integrity or
you'll need to continue in audible.
or that child innocence has been affected in a serious way. So now this child's having to make decisions while carrying the stress and the burden of the molestation that he or she has experienced. But also, we talk about someone, the sister or the brother in the home who witnessed the father molest their siblings. Now, the child who witnessed this traumatic experience, now all of a sudden begin to act out in a way, begin to not want to be maybe engaging with the father, maybe is afraid to be alone with the father, or may be very protective of the sister, and for some reason the mothers in the home or the family members don't understand, what is going on with my daughter? Why is she acting like this? Or she may speak in a very violent way toward the father. But again, only because she witnessed, because the stress again, what's happened is, in her mind, she is put in a stressful situation that what takes place, what happens is that she go back to that primal state, if you will. You go back to that primal state, if you will. It goes back to that primal part, say, of the brain, where the primal part of the brain, what kicks in is what is simply, that flight, that freeze, or that fight is being activated, say, within the brain. Because see, many times we in our normal everyday life, we function at what we would call, say, in a higher state of consciousness. But when our life is being threatened, that primal state kicks in, which is part of the autonomic nervous system, that where it takes us to a place within ourselves, that where now, do I have to defend myself? Am I going to run? Or do I freeze? So what's happened is, the daughter, the brother who has witnessed, say, maybe a parent molesting younger siblings, they are reacting many times on their primal part of the brain and not necessarily, say, the executive part of the brain. So when we talk about trauma, so we know trauma can be environmental, as you see, according to the definition. So what is taking place in Baltimore City that these children say having to leave their home, walking to the bus stop, hearing gunshots, or they're seeing, say, unfortunately, men and women, say, who have been using drugs, and the children, say, 8, 9, 10 years old, they know that these men, because they come home and talk about, they saw a junkie on the corner, or they saw this crackhead. They have definitions for the people they have seen, but they also know the drug that people are using. So again, we talk about environmental trauma. Many of these kids having to live with this environment, having to walk to school, feeling threatened, not feeling safe. So how is this impacting them? So again, but what reality has been created, what environment has been created that where now we're having to raise our children, say, within this environment? So what is taking place in the brain? Because I want us to be very clear about what is happening here when we talk about trauma or how it impacts the brain. So as you can see on the screen behind me, I'm going to talk about the prefrontal cortex, the amygdala, and the hippocampus. So we know that the prefrontal cortex of the brain, that front part of the brain, the forehead, if you will, is responsible for planning and making, say, rational decisions. Okay? It's impulse control, moderating our social behavior. We know that the amygdala primary role is the formation and storage of memory. So again, think about that little girl who had been traumatized at 6 years old. When she became traumatized, what happened is that experience is stored, say, in her amygdala, that part of the brain. Now it's there. The reason why it's there because in the hippocampus, what the hippocampus does, the part of the brain is, it takes those memories and it convert them to short-term or long-term memory. So whereas she made that same little girl who was less than 6 years old, say now she's 16. And let's just say that maybe she watched a movie. She watched a movie of maybe a father molesting his own daughter. Well, that triggered something in her, so that memory that was stored, say, in that long-term memory, now has been brought back, say, to her conscious memory. Well, because that's a trigger. She was triggered by the event of watching the movie, and now all of a sudden, she's in a situation where, you know, her heart is racing, she's breathing heavily, she may be angry, she's crying, and the people around her, maybe a sister or a relative, don't understand what is going on with her. What has happened is she has been triggered by a movie that she has witnessed because in her hippocampus, that memory has been brought back to the conscious state. So as we see right here, as I talked about the prefrontal cortex, what happens is the stress, the psychological stress of carrying a traumatic experience began to weaken the brain, if you will, in terms of its psychological ability to make strong, healthy decisions. It began to weaken that. And it began to affect, say, your impulse control. It began to affect your ability, say, to make rational decisions because you're carrying the stress of that trauma. You've been carrying that stress, say, since you were 3 or 4 years old. Now you're 12 or 13 or 14 or 15, yet haven't dealt with that trauma. And when you leave the home, when you leave, say, and go out into going to school or going to your work, and many times people around you not understanding what is going on with this particular individual person, as a result, because the person now along the way has been triggered by maybe something on the bus stop, or maybe has been triggered by something someone says because of carrying the stress. So I want to tie this back in to my particular population, because what we have here when we talk about these young African-American young men, say, who have been traumatized in some way, form, or another. I talked about the profile. I talked about what PITS is. I talked about what they're experiencing. So now I'm talking about what is taking place inside of their brain. So now I'm 14 years old. Say maybe I was beat, I don't know, by my uncle or my father. Or maybe I was molested. And I didn't get the help that I need. So as a result of that, not getting the help, as a result of my ability to make rational decisions, a healthy decision has been weakened by the psychological stress of carrying the trauma. So there's a thing called now my impulse control, we'll say, is off a little bit. I'm easily agitated. I'm easily annoyed. I seem to be angry. But see, what has happened is that I talked about that primal state, if you will, we're stuck in a primal state. Fight, flight, or freeze. We're stuck in that position. So even when we see the young men, we say, why is he angry all the time? What's wrong with him? Because he's operating from a primal state, and he's not operating, say, from a healthy state of mind. So what's happening is we talk about the autonomic nervous system. The autonomic nervous system is made up of a sympathetic nervous system and a parasympathetic nervous system. So as you can see behind me, and I'm going to kind of point to it on the slide right here, when we talk about the parasympathetic nervous system, we will call that, I like to use the word P for peace. Parasympathetic, P for peace. You're in a peaceful state. You're breathing, say normal. Your pupils are not dilated. You're not hypervigilant, because pretty much you're at peace with yourself. Well, what happens is when you begin to experience trauma or triggered by trauma, as a result of that, the sympathetic nervous system kicks in. Now the body begins is activated. We say within your nervous system, you begin to respond to your primal state. You begin to breathe, faster, more rapidly. Your nostrils flare open. Your eyes are dilated. So now you're more or less in that fight, flight, or that freeze response. Because now in your mind, you're experiencing a threatening situation. So keep this in mind now. So many times, unfortunately, the young man who has been traumatized, who's operating from a primal state, this young man, this young woman is stuck in his sympathetic nervous system. This kicks in because each and every day he get up, he go out into Baltimore City, and what happens is that this young man feels that he has to carry a gun. This young man know that he has lost friends his age who was murdered, a violent death. This young man also know that that most of the people that his friends and if we would say his rivals, they have guns. So this young man's sympathetic nervous system literally is stuck just like that of a soldier who's engaged in conflict, say over in Ukraine and fighting the Russians. Because every day that they get up, they're experiencing bombs exploding, they're experiencing gunshots, they're experiencing, say, their battle buddy, if you will, say, was killed in battle. So you take that same environment, let me rephrase that. You take that same reality and you put that on the streets of Baltimore. So here's a young man, he gets up in the morning and his friend has been murdered. He hears gunshots. Maybe he himself has been shot someone. So the brain doesn't differentiate between whether I'm on the streets of Baltimore or whether I'm in Ukraine fighting the Russians. The brain only knows is that I'm being threatened. I'm being threatened in such a way that I have to protect myself. And what kicks in again is that primal state. I'm either going to freeze, I'm either going to flee, or I'm going to fight back. And many of these young men in that state, they are fighting back. Some flee, some freeze, but many of them fight back. So this is why they're carrying the guns. This is why they're engaged in conflict with one another, because on the streets of Baltimore is literally a war zone. It is no different from that in Ukraine. The war taking place in Ukraine, other than the faces are different, the geographical location is different, but in terms of how the mindset process their reality, there's no difference.
Can I ask
Yes, sir.
a question? So, I noticed you already prefaced the doc with the that you think that you can generalize the research here and what you're presenting. So most of our students are up in Pennsylvania.
Yes, sir.
And they're in rural and also maybe even the city of Pittsburgh.
The brain doesn't differentiate between whether or not, say, this person lives in in West Virginia or Pittsburgh or live in Baltimore City, New York. What the brain does is say, well, look, what you're experiencing right now is a traumatic experience. Now, how do you deal with that? Now, a lot has to do with personality. A lot has to do with within how someone, their belief system, because not all people experience the trauma in the way of impact in the same way. An example, there are many kids who live in Baltimore City, say who go to school, and they seem to function okay, you say, if you will. There are many soldiers who engage in war, say, who return home from war, and they seem to do okay. But there are some soldiers who come home from war for whatever reason, they can't maintain their marriage. They turn to alcohol and drugs. There are some kids, for whatever reason, who grew up in Baltimore City, they may turn to drugs, or they may get involved in gangs. So personality and temperament has a lot to do with how someone responds to trauma, but we all are impacted by trauma on some level. So when we talk about growing up in Pittsburgh, when we talk about growing up in Pennsylvania, we talk about a demographic that does not look like Baltimore City, a white male or a white female, or we talk about an income, whether it's a middle class income, or we talk about a poverty level income. I'm saying that when the young lady, if you will, say who growing up in Pittsburgh, Virginia, she come home and there's no food in the refrigerator, her little brother or sister is crying from being hungry, or the mother, say, is seen to be struggling. So again, the idea of having that experience, not able to feed, say, or to feed her family, or having the means to feed her family. So again, how is she impacted by that? So this is a vital experience for her as well, because the threat possibly of her little brother, little sister, say, not getting something to eat. This is also a threat, if you will, say to, to her well-being, if you will. The fear possibly my little brother and sister becoming, say, sick or worse, dying result, or maybe not having the means to be able to take care of themselves. Talks about the war. This particular screen, it talks about war in Iraq and Afghanistan, but also the war in Baltimore City, Chicago. So as I talked about, so you have two different populations, if you will. You have a soldier in Iraq, and you have what we call a soldier on the streets of Baltimore. So many times, I'm sure you've heard, whether you heard on the news, whether you heard, say, maybe a book, or you read it within a book, or in a conversation you've had, that many of the young black men in these urban cities call themselves soldiers, okay? Just like in the military, the Navy, the Air Force, the Marine, in your United States military organization, they call themselves soldiers. So also, within these two different groups, they both carry weapons. We also know there's a brotherhood. Many times we say, the gang members say, this is my brother right here. A soldier would say, this is my brother. We also know that both groups consider themselves to be family. We also know that they both groups experience death. We also know both groups experience belonging to a sense of purpose, if you will, belonging to something. They also know that both groups see themselves as being part of a purpose, something greater than themselves. But we also know that both groups experience trauma. So on one side, with a soldier, we have PTSD, post-traumatic stress disorder. I know from personal experience, in terms of working within a military environment for over 20 years, for working 13 years, say, with the Department of the Army, 7 years with the Department of the Navy. I know from personal experience that when the soldier returned home from Iraq, Afghanistan, they're going to experience what we call debriefing. They're not going to just immediately come home, be with their wife, be with their family, without going through a debriefing process. What does debriefing look like? Debriefing, first of all, look like they're placed in a location, they're talked about their experience, they're evaluated, in this particular location. They also determine whether or not they need to receive treatment, but also, do they need to receive medication? Do they need to receive mental health? There's also research that's available to support, say, the military position on making sure that when these soldiers return home, male or female, that they have the scientific data they need to make sure these people are safe, but also there's hospitalization. Why is this? Because the military, who's been the Army, Air Force, Navy, Marine, has been around for at least over 200 years. We know that they have made an enormous investment in making sure, how do we get this right when we engage in war? So on one side, you have the soldier who have experienced all of what I described that's up under the war of Iraq. And what happens is to make sure that he or she is good. But now, on the other side of the screen, if you will, the war of Baltimore, Chicago, so not the same individual, but this individual who considers himself a soldier, who carries a weapon, who's part of a brotherhood, who's part of a family, who experienced death, who experienced belonging, who experienced purpose, loss, trauma. What happens is there's no treatment for this particular individual. There's no mental health available for this particular individual. There's no research available for this particular individual. And there's definitely no hospitalization. How is PIS manifested? It is manifested through a psychological maladjustment. It is manifested through stigma, lack of social opportunities, old process of thinking. So you can see the very areas in which how PIS is manifested, say, within this particular vulnerable population. But so this is the area that I want to get that's very important we need to understand. What are the central contributing factors to the African American male psychosis? So this is the part that I want to focus on that I think is very key, because everything I talked about, for the most part, is a result of something else, a greater picture. The African American male, the prison, incarceration, the profile is a result of what? So institutional racism, cultural misorientation belief, and the negative post-incarceration transition experience suffered by African American males are the central contributing factors to their potential undiagnosed mental illness. This is my argument I'm putting forth. Is that African American males who are experiencing this, what I call undiagnosed mental illness, is if the impetus, if you will, lies at the foot of institutional racism and cultural misorientation belief. So why do I say that? And I would argue within the African American male, what's happening is a cultural misorientation because the environment that we grew up in, that we're growing up in, it is anti-African, it is anti-black, and it creates a self-hatred, if you will, for some of us, keep in mind, street if you will. But if I can influence the mindset of some to a degree that where now you will turn away from who you are in your God-given principles, if you will, in your moral makeup, and begin to develop a personality that will be unlawful, that will be misguided, that will be irrational, then I have accomplished my goals. So out of 10, if I can convince 4, I'm winning. If I take 1, I'm winning. But definitely, I like to have all 10. But some of us is not going to be influenced by that. Because of personality and because of temperament. But some of us, because of our traumatic state that we're in, we give way to that reality. Okay. So what do we have right here? Should have changed that. We talk about 2022. We know it's in 1876, the black male could not vote, be on jury, denied unemployment, professional license, housing discrimination, education opportunities. You have a felony conviction in 2023, even though it's in 2018. In 2023, that is still in place. So what are we looking at here? So in 1876, in 2022, the black male who has been convicted of a crime still are experiencing, say, a social reality that his ancestors experienced in 1876. Again, this has been institutionalized. I don't have to say anymore, I don't have to come out anymore and experience, say, what my great-great-grandfather experienced, but it has been put in the policies, it has been put in the institutions, then it will be self-sustaining. The problem is African American males are transitioning back from prison emotionally and psychologically not prepared to cope with the transition demands. They're ill-equipped to face the economic and education demands of the 21st century. They become a permanent racial underclass and not receiving effective mental health treatment. That's the problem. That's the problem with what we experience today with this particular population. So for me, that was a gap in the mental health community. African American males are transitioning from prison back to mainstream society with a potential undiagnosed mental illness. And I say undiagnosed because even in 2023, now keep in mind, I was talking about this. I wrote this book right here in 2012. It was published in 2012. I wrote this book. So here we are in 2022. And I started the research before 2012 because once I completed my dissertation, I realized there's a gap somewhere. I was having these thoughts and ideas when I was in my doctorate program. There was a gap somewhere, and where's this gap? What can I do to contribute, say, I was arguing in more of an effective way, not just regurgitating, theories and ideas that I was educated on, when I was in these institutions, but really, how can I take the training that I received? That I was, great schools. But how can I take that training and utilize it in a way to be of benefit, say, to my community? Not just come out to regurgitate what I received there, but how can I really take the skill of being a counselor, a researcher, a intellectual, if you will, and begin to create more practical approaches in dealing with what I would call a mental health crisis that we've been in for I don't know how many years. So for me, it was undiagnosed because many of these men whom I saw myself, I was one time myself like these men, friends I still have in prison today, they're coming home with this undiagnosed mental illness. Now, the closest we come to it is PTSD, post-traumatic stress, which is okay. But I would take a step further because we're talking about something that's impacting these black men. And it is the stigma of incarceration, it is the history of criminality, it is the history of incarceration that specifically these black men are experiencing that's impacting their lives. Even though there's trauma involved in their experiences, but it's also specific, identifiable markers that we can touch, we can see that's contributed to this as well. So let's really talk about the 5 transitional stages. We're talking about what I call the passage. They call the pre-release transition. The pre-release transition. See, in this stage right here, and I'm going to quickly go through this right here. You just found out you made parole. I call it the passage stage because from prison to outside that gate, I call it a passage, if you will, that one's traveled. Now, this is an emotional journey, it's a psychological journey, it's a spiritual journey. But in this particular stage right here, that I just received the news, I'm going home. We all experience pre-release transition anxiety, confusion, excitement, and fear. Because many of us, when we're released, we have nowhere to go. One, you can't be released anyway. You don't have a home plan. You're not going to be released anyway. Okay? Because of what we have done in the community, we can't go home. We burned our bridges, if you will. The family member won't accept you. And those that will accept you, you really don't know them because you've been gone from them. We'll just say 5 years or 10 years. You've changed, they have changed. But also there's confusion because you live in a world that is totally different from the world you're going back to. In this pre-release state, there have some men who have intentionally done things because they do not want to be released. They have intentionally sabotaged their own parole because they know they have nowhere to go. They know if they release, they have to take care of themselves. And there are some men, not all, but there are some, because they have been taken care of, if you will, it's called they have been dependent on the state. Their food, their shelter, their clothing, their medicine, their entertainment, their recreation. They don't want to leave. Because coming back home means now I have to be responsible for waking myself up. I have to be responsible for going to work. I have to be responsible for taking care of my children. And some of them, unfortunately, don't want that responsibility.
So, Doc, if I'm hearing correctly, I mean, you said that these the closest diagnosis, which is in the Diagnostic Statistical Manual of Mental Health Disorders, would be PTSD.
Yes, sir.
So I infer that you're suggesting that this is a trauma of sorts.
Yes, most definitely. Because when we talk about, of course, we know PTSD, obviously post-traumatic stress disorder, and we know all of us can experience post-PTSD. I talked about trauma. I defined what trauma is according to the American Psychiatric Association. I talked about the 3 different examples: direct trauma, hearing about trauma, witnessing trauma. I gave examples about someone who's been traumatized. But when I talk about PITS, which is Post Incarceration Transition Syndrome, I'm specifically talking about an African American male population who, many of them have experienced trauma, who are still operating within their traumatized state, if you will, but exacerbated by the fact of being incarcerated or having a history of criminality, but also by systemic, if you will, racist environment that we have grown up in. Now, again, I talked about it is not the system. The system of institutional racism doesn't have to catch all of us, but it impacts all of us. So the trap is set to where, look, if I set a trap, if I can catch, say again, all 10 wolves, that's great. But if I get 2, 3, or 4, then I'm okay with that because the impact of 10. We stronger as a 10, we're weaker as 7. And so the trap is being set that some of us, black men who experience this, that when we are caught, if you will, if we've been influenced by this systemic institutional practice in a way that where it impacts my family. Me and my wife, we're not working as a unit anymore. We're not co-parenting. We can work as a unit. We can raise our children together. The impact is financially, not supporting my children. My wife doesn't get the help that she needs. The impact us in the community way, that where we have young boys raising themselves, unfortunately, because the father's not there. There are so many variables that take place when those who have been caught up within this system, if you will, give way to it and don't receive the help that they need. So definitely is that.
So when I hear you say that, I'm also thinking, you know, when you say all of us, I'm thinking really all of us, you know, because at some point somebody might or may become, the system is negatively impacting these brothers that you're speaking to, right?
Yes, sir.
But it's also impacting their family. It's also impacting, of course, their immediate, then their extended family and community, but then also other communities and just this society in general. So nobody, for the most part, besides those 1% of the 1% of those who benefit from such chaos, most of the society is really being impacted in a negative way.
Right. Now, I agree. And to give an example, we just experienced, well, we didn't, but say the people of Florida, in Tampa, Florida, who experienced the hurricane, I want to say, last weekend, the end. Okay? So we know Tampa, Florida got hit. No, they got the impact of it. Devastated. I think it's 120 people, I think, has already been identified as, lost their life to the result of the hurricane. The city itself, the buildings, just no devastation. So Tampa, Florida got hit. But also we know that when we talk about Florida, the next state up is Georgia. You got Georgia, South Carolina, Alabama to the left of Georgia. You got North Carolina. You have Virginia. You have DC. So even though up here in Maryland, we didn't necessarily get, say, the direct impact of Ian, the hurricane, but we did get remnants of it. Wink was talking about that, how it kind of had that rippling effect. The immediate family, we say, would get hit the hardest, if you will. The father's not in the home. The wife is out with her husband. The children don't have a father. So we think about that immediate home as being Florida. But then we think about the community, if you will. We think about that being the state of Georgia. Even though the remnants of it is kind of impacting Georgia with the strong winds, the rain, they're disruptive. But then you have the next state of Georgia. You have with Georgia, you have South Carolina. So the impact of decision that, unfortunately, that when we as African Americans, when we make those decisions, we impact our family immediately. But then the community get hits. And then when the community get hits, the other areas, say, within the city is impacted by it. We know right now.
But when we're thinking about those are more gentrified neighborhoods and those neighborhoods that are more oppressed or impoverished neighborhoods, how the impoverished neighborhoods are, it seems like it just doesn't just stop there. Where when there's something going untreated or it's going to impact the entire city. And using Baltimore as an example, it doesn't just stop in what we call those overlooked neighborhoods, which African Americans particularly live in this city. It also affects those neighborhoods which have been gentrified, and the business communities and all these other things. So, as I would say, as Dr. King says, injustice anywhere is injustice everywhere. So it would impact. So the blight or the trauma is affecting the entire community at large.
No, you have to be correct, brother. I think for the observation, there are some who believe at one time that behavior can be contained, if you will, to just a geographical area. But what I've always maintained is that one of the things that was so successful in creating this environment was, I like to use the Frankenstein analogy, that the people was focused on Frankenstein. Frankenstein was a monster. He was mean. He was vicious. But they never focused on Dr. Frankenstein, who created the monster. It was always Frankenstein. So when Frankenstein came up out the basement, people started wondering, "Oh my God, Frankenstein, he's loose now." See, but they never focused on Dr. Frankenstein, who created the monster. The news media, they focus on the kids. So we think about the kids in this analogy as being Frankenstein the monster. Not calling the kids monsters, long from being monsters, but in this analogy, The kids represent the Frankenstein. But they don't focus on the system who created the kids, which is Dr. Frankenstein. So news media, so they never shine the light on Dr. Frankenstein, which is the policy, the institutions. I'm not going to say never. I'm not going to use that word. That's extreme. But I was a balance, if you will, a fair balance of saying, well, look, there had to be something greater going on here. That where we, year after year after year, we're seeing children, 13, 14, 12, who are emulating, who are acting out in ways, something got to be going on. Will be involved in the music industry and the video. So I'm saying is those who operate these systems, whether the music industry, the education industry, the legal industry, those who operate these industries, if you will, in such a way that where it's producing and creating, that's playing on the trauma of these men and women, family communities that are creating this, but the focus being on these children, i.e., oh, that's Frankenstein. But those who are creating that, Dr. Frankenstein, we seldom do we hear the focus or the blame, if you will, is addressed in that way. So definitely, there has to be a shift in the conversation, in the narrative. Now, do we get the young boys help? Sure we do. We give them help that they need. And what does that look like? But at the same time, we help those who are creating as well. Because I would maintain those who are creating is just as sick, if you will, irrational, if you will, dangerous, if you will, of the monsters, i.e. Frankenstein, that they have created. And unfortunately, we don't always address that. And we need to help those who work, within, the mental health field, who wants the help. And they see what is happening with, the men and women, what's happening in society. And you have those who want to maintain, if you will, what is in place. You have those who want to maintain the status quo because it benefits them, in a greater capacity. They maintain the power, they maintain the dominance, they maintain their way of life. So those who work within that system, they begin to say, well, look, wait a minute, we really need to be helping these people. And though some may have the courage to say, you know what, I'm going to go against maybe what the status quo is, now they become an outcast, if you will, of those who work against the system and in a way that where, what is that we need to be doing differently in order to make a change? The system, change the system that's currently operating. Because as long as we continue to operate in the manner which we're operating in, then the system forever will be in place. And we'll have pockets, I mean, pockets, but we'll have some people, you will, that will come along and make an attempt to make a change. But because of their lack of power, if you will, it doesn't even put a dent in the system. So you're definitely right in what you're saying, Dr. Sir, as well as what you said.
So when I hear you say that, and I'm not sure how much longer we have here, but I'm hearing, so as counselors, the ACA and I think it's multicultural social multicultural. I think it's slipping me now, but the committee to fight for social justice and things of that nature, and counselors not only intervening in the counseling room, also being a more societal advocacy type of action. Are you suggesting that clinicians understand this in the counseling room, but also utilize their skills, sets, talents, ability to also advocate to change these things that are causing trauma that are systemic and coming from what we're calling here the system?
Yes, I would definitely agree that kind of break down your response is that you have those, say, the counselors who are in the room, if you will, and they're working with people on a daily basis, and they see the trauma, they see the impact of the trauma, what it's caused, say, with an individual person, a family, and a community, and they're working because they're working in such a way that where right now my client is my focus because this client is in such need of services. I focus on my client, but also that same counselor also understand that there are systems that are in place that is contributing or may not understand. So one, the counselor who is working in this environment, one, needs to be educated if they're not, in terms of the system that they're operating within, and make the connection in terms of how this client, the behavior that they're demonstrating is a behavior that was created by the environment that they live in, and the environment that they live in is being created by a system that was put in place hundreds of years ago. So counselors understand both the behavior they're seeing in an individual person and what can I do to stabilize you with this person, but at the same time, how do I address the system that continues to create this behavior year after year after year? And so now that counselor has to say, well, no, what can I do? And I go back to what I said at the opening is, to the younger generation, or even those already in practice, is that it's not just enough to get these talents and skills and say, this is who I am. But how can you affect change with that talent and skill? When you look out in society, it don't have to be African American males. It can be women, it can be children, whatever area that you're looking in or looking at, and you see abuse, you see violence that's perpetrated. Because many times we talk about violence. If I say someone was shot on North Avenue, that was violence. But if I say someone was thrown out of their house because they couldn't pay their rent, we don't see that as being violent. Because I go back to what Dr. Wayne would say, power is the ability to define reality, convention is your reality. I would argue that it is equally violent to throw a mother and children out of her home, knowing she doesn't have anywhere to go. That's violence. I would say equally violent, say, to allow people to sleep on the streets. Even though some, because the mental health state may want to be on the street, but there's a system in place to say it's okay in ways that where that person sleeps up on the bridge, women and men. That's violence because of what it does to the psyche of the individual person. So many times we look at violence as being a physical act. The person hit me, the person cut me, the person shot me. But we don't see violence as I've been displaced from my home. My family has been separated. Again, the former President Trump, when he was in office, when men, women, and children would come from other, say, South American countries, and their family was taken, and their children were separated from their parents, that was a violent act. We go back and look at slavery. One of the things that they did in order to control, they took the mother, they controlled her, they took her child from her and sold her a different plantation. Or they told the father, they separated the father and the mother. That's violence because it disrupts. What it does, it disrupts your ability to function, if you will, in a healthier state of mind.
And as we know today, with all types of research, although we didn't need to have that research per se, but research does support it, the attachment system.
Yes.
And when we look at the breakdown of the family, and we look at it from, let's say, more what's happening in the present, but you're saying we're not only being impacted by what's happening in the present, we're being impacted what's happened historically, which is generational trauma, which is also compounded trauma as well.
Yeah, you have to be correct, brother.
Hence, we have individuals who are out in a society that are being incarcerated due to some behaviors which was created out of a violent society.
A violent society.
Yeah. So what I want to do is wrap it up.
Okay.
At some point, I don't know, you probably got to send home type of message, or some skills, or some maybe some multicultural or even spiritual implications.
Okay.
Right.
But definitely, so when you ask the question is, okay, as we move forward, basically, what is that we can do? How can we help? How can we really begin to affect change? And some of the things that, and one of the things I talked about as this particular population. See, what is the implication? See, African American males will continue to fail to restore their mental health unless there is an individual and collective effort to address the institutional racial practices that influence and shape their social and cultural development. So that in itself is the implication. I think we have to start with the beginning. You know, what has created this world, if you will, that we live in? What has created this environment that we're both black and white are both impacted by institutional racism? You have one group believe that they're superior. You have one group believe that they're inferior. Both are being impacted by a system that has been detrimental, if you will, to both group psychology. Has been detrimental to both groups, say, mental health and well-being, because it gave the false belief that to white people that they're superior, and it gave the false belief to black people that they're inferior. So we have to begin there. So with those who are working, if you will, say in these areas where you're an educator, whether you're in the mental health field, whether you're in the legal field, whether you're in the business community, one, we have to begin to educate ourselves as to the system in which we live in. Now, is the work easy? No, the work is never easy. And we will find ourselves passing this responsibility on unto a later generation, as those who came before me, say, who passed the work that needs to be done on to me, that I witnessed, you know, the men and women, the nameless men and women, who worked in the community, want to make the community better, a better way of life, if you will, you know, for themselves and their families. So the reality of it is that it's going to require multi-generation, if you will, of effort to begin to make the necessary change that's necessary, say, with an education system. Now, that's one way. In my opinion, there's a way, because the other way is really doesn't fare well, if you will, say, in trying to change the system in a way that will be further detrimental to the well-being to the community. So those who are in education, who are in mental health, medical, the religious institutions, the business community, federal, state, private level, you know, educate themselves to the degree that we want to make a difference in this way. Secondly, cultural misorientation will continue to be a psychological maladjustment among African American males if the unhealthy learned behaviors are not eradicated from the inclination of their subconscious. Meaning, this is speaking directly to the men and women who are affected by that. There has to be a deep dive, if you will, into the subconsciousness of those. And I say that it seems simplistic. It's going to require a lot of work, but that there has to be an approach that is being developed that where we can begin to reach. And I think it is education. You know, in terms of things, it's a great effort. A place to start. Begin reaching the children, because subconsciously we have to begin to address for those. Now, even though I think it was Frederick Douglass who said that it's easy to kind of paraphrasing, but I guess it's easy to help a child than it is to repair, say, you know, a broken man. And I understand what he meant by that. But in the long term, we have to begin to repair the broken men, because the children can't govern themselves. They can't lead themselves because they're children. They don't have the maturity, they don't have the wisdom, they don't have the discipline, they don't have the foresight, the forethought. And they're going to make mistakes because they're children. So the broken men, the broken women, they have to be restored on some level where we begin to turn this thing around. And I said, what I mean by turn this thing around is how to begin to turn around, say, the social dynamics, the social ills, you will, in the African American community, as well as society as a whole. Also, the criminal mindset of African American males will continue to be a profitable investment for many social institutions unless there's a change in the economic psychology of the black male thinking. Okay, read that again. The criminal mindset of African American males will continue to be a profitable investment for many social institutions unless there's a change in the economic psychology of the black male thinking. Who are benefiting from this mindset? Okay, let's start with the social workers. No, I'm going to rephrase that. Let's start with the mental health community. Okay, billion-dollar organization because of the thinking of black, not only just black male, but contributing to that. We think about the pharmaceutical community. You know, the drugs that are being prescribed. Say, I have clients who've been on medications. They was 3 years old in elementary school. They're 18, they're 20, they're 21 years old. The pharmaceutical company is benefiting, say, from this, from our irrational thinking as black men. So we know the pharmaceutical companies benefited from the legal system. What are we talking about? We're talking about the attorneys, the prosecution, the probation officers, the parole officers, the judges. They are benefiting economically from our sickness, if you will. I'm talking about sickness of our mental health, of being profitable because of where we are. You know, the school system, they're benefiting from that. The business community, they're benefiting from that. In ways that where the federal government, in terms of the federal institutions. So there are many institutions that are benefiting from the irrational thinking, the mental health, the unhealthy thinking of African American male men and women in our community because of the decision that we're making, because of the system that created that. So why would the pharmaceutical company want to make a change when it's a multi-billion-dollar operation that continue to prescribe medication for children, and when we begin to multiply, we're just talking about Baltimore City, but we begin to multiply that across the United States, if you will, in major cities where children have been on medication since they were 3, 4, 5 years old. We're talking about hundreds of thousands, millions of children, are being prescribed medication, and the pharmaceutical company has gotten rich and wealthy, and these 1%ers are living like fat cats, man. So they're benefiting from our sickness. They were Dr. Amy Wilson who said that that is necessary. It's necessary for African American men and women to be sick in order for these institutions to continue to maintain their wealth and their way of life. It is necessary. They mentioned the prison industry, private prison, state, federal, and private institutions, multi-billion-dollar industries. So who's filling up these jails? African American males, some females, some white males, some white females, but the predominant population that will fill up these prisons are African American men and women. Multi-billion-dollar operation. So definitely, when we talk about the economic psychology of the black male, people have been benefiting from that for years. Untreated will continue to undermine African American male social opportunity and stability within his family and community. Again, we talk about the family. It's not being treated. Been in prison, come home, can't adjust, go back to prison again. So how many times has my wife gone through that? 2, 10 years, 15 years, 20 years, left from a child this age, come back, go back to prison again, and there are families like that. The father come home, 6 months, can't adjust, go back to prison, and the wife is still, she's supporting him. She's standing by him. But because he's not dealing with what's going on with him, the stigma, not making an adjustment, so now the family's still in the state which is in. The mother, for the most part, is still without her husband until not their father. It's a perpetual cycle. So we talk about the implication. The implication is beyond crisis state at this point, in my opinion. What are the recommendations? It starts here. Mental health practitioners who truly understand the psychological crisis that African American males experience must lead the way with new and creative ways to establish practices centered in restoring a healthy therapeutic environment. Point blank. We got to take the lead on this right here. We got to take the lead. As someone once said to me back in 1985, when I was in prison, in Holman Prison, in Atmore, Alabama, the mental health workers, we got to restore that. This is where we come in. It's going to be a lot of work, but this is where we come in. Because we're responsible for the mind for many of the people that we deal with. But if we're not right, we're not going to be able to reach the people. And they're not going to be right. But that's the way it's done, because we still operate with all the money, wealth that we have, with all the training that we have, with all the education that we have. Why are we still in the state that we're in? The educators and mental health professionals must develop pedagogies that address institutional racism practices that affect the psychology and development of African American males. We got to put it in the schools. We have to begin to develop curriculum where the curriculum address these issues in the school. Not just talking about Black History Month, African American History Month. I'm talking about curriculum that begin to really address these issues in the school. We know the mental health practitioners, they have to address it. The educators, we have to begin to, we talk about in what, Waynesburg, Harvard, Yale, Morgan. Not saying that they don't on some level, but to what degree? Because something ain't right. You can't say you're doing these things, we still got the problem. John Hopkins, something not right. So we got to begin to address these institutions, meaning the teachers, the professors, the adjunct professors, those who have tenure, those who write the curriculum. We have to begin to address these issues on a greater level and begin, but have an understanding of what we're dealing with. Then, of course, I would say the business community. It says mental health practitioners, the business leaders, and mental health professionals must implement effective strategy. The business community has to be involved in this. Well, on the state level, federal level, private sector, they got to be involved in this right here. Meaning in the development, because many of the crimes that are being committed in the African community are economic crimes. Unfortunately, there are murders being committed, but being committed out of an economic necessity. Selling drugs, economic necessity. Robbing, economic necessity. Because what? I don't have the education, I don't have the training. So what? I rob, I still sell drugs, I hurt somebody because I'm trying to feed my family. Because society is saying, if I have these things, I'm somebody. If I don't have these things, I'm nobody. Again, dangling the string. And I was like that until I realized I'm somebody because I'm a child of God. You talk about the spiritual part of it, but I'm a child of God. So once I became aware, I said, well, you know what? I had it all wrong. I'm trying to take something outside of me to make me feel good when it's already on the inside of me. So when I begin to embrace myself, when I begin to embrace the reality that I'm a child of God, the outside thing is important, but not to the degree that I'm going to commit crimes for them anymore. Because now I understand who I am. And it wasn't those things that made me somebody. Those things are good help because we have a material nature. They help perpetuate life. But the essence of who I am is a spiritual being. But these kids, they're fighting for stuff to go on the outside of them and not what needs to go inside of them. And so until they learn that, they'll continue to be perpetuating this because they're thinking that once I get this car, once I get this house, once I get this money, once I get this community, once I get this neighborhood, I'm going to be somebody. Because society is seems to say it's about materialism and that you're somebody if you got something. But I learned that no, I'm somebody because the Creator is saying I belong to Him. So that was my turning point. And Peter said, whoa, wait, I've been doing this thing wrong, man. And that's when my life began to change. And I began to embrace that reality and stop chasing something outside of myself when it was there the whole time. I just had to give way to it. Last, mental health practitioners must work to develop effective strategies to address known areas of threats that undermine African Americans to cope with the lack of social opportunities and Post Incarceration Syndrome. Again, the mental health practitioner plays a vital and critical role, and I'm talking about social work, psychologists, psychiatrists, professional counselors, marriage family therapists, drug addiction. We play a very significant role, and we got it. It's been a pleasure. This is what I enjoy. You know, I can talk for hours at a time about this issue is very dear to me. And know some of the information, you get the opportunity to really go through each slide of the presentation, but there was a lot, as I talked about, as it pertains to African American male. But hopefully, the piece about this trauma and how it does not matter necessarily, you know, your geographical location, your ethnicity, your sex, your gender, is that because what you're experiencing is that when the brain has been impacted, it's facing an experience so traumatic, it impacts you in a way psychologically that it threatens your well-being. This is what when you experience a threat of some kind that's so devastating to your makeup that it causes you to where you begin to rely on your primal responses to address the threat. Then that's when you've been impacted by the trauma. Because the reasoning part, the prefrontal cortex now has, if you will, is not operating now. The primal piece has taken over. So now you're in that fight mode, or you're in that run mode, or you're in that freeze mode. Because there's that primacy which our early ancestors, when going through the stage of development of the human being, they operate primarily from that primal. This is how they operated on. You know, eating, sleeping, hunting, reproducing, sex. You know, fear, flight, freeze. They're stuck until they begin to develop. The brain begins to grow and to develop. Then begin to function in a greater intellectual capacity. But that primal part is still there. And unfortunately, these kids are stuck there because it's where they operate from. Because it's stuck. It's like there's no relief from that. They go to bed angry. They wake up angry. They don't understand what's happening to me. Because they're stuck in that primal state. There's always, I got to fight somebody, I got to run for somebody, I'm going to freeze. It's always in that state. There's no relief. The soldier come home from the military, he goes through a systematic process of debriefing to making sure before he goes back to his family, they'll look at every area to make sure he's okay. With that kid on the streets, they're going to come home from prison, there's no debriefing. Open the door, you're free to go. And he brings all that stuff with him to his family. And they don't understand what's going on with him in the community because we're not addressing those issues. So I'd like to close with saying that to the class, if you want to know more about transition therapy, the title of my book is called Transition Therapy. It's called Theory, Research, and Recommendations for Treating African American Males Experiencing Post Incarceration Transition Syndrome. My name is Max Ragland. You can go on there, or you can send me, you can email me directly. You can see the email right up here. Let me put my cell phone number up there, but definitely Uhuru, UHURU 357 at hotmail.com. I do have a Gmail account. For y'all probably got a Hotmail? Don't worry about it. I do have a Gmail account. My Gmail account is freshair112194 at gmail.com. Again, my Gmail account is freshair112194 at gmail.com. Or you can use my old school email, Uhuru357 at hotmail.com. You can email me, you have questions, you want to learn more about transition therapy. So feel free to reach out to me. This is what I do. As I share with my wife all the time is that I got a lot of stuff in my head. I hate to transition, without being able to share what I have in my experiences, with a younger person who's literally going to be to pick up this work and move it forward. So I think I've started something great in terms of identifying, developing a theory and approach around work with American male. It's not there yet completely. There's a lot of work that needs to be done, but I do genuinely believe that it was God sent. I believe that 100%, it was not every fiber in my body. But now, how do we advance that forward? But at least I'll be able to take it, develop it. Now a younger person may come along and build on it, and feel free to do that. It's not mine to keep. It's mine to share and give to the world. Whoever you are, take it, build on it. Let me assist you, let me help you, give you some ideas, but definitely it has to move from where it is right here. This just started in the room with an idea. I worked it